All right. I think we can go ahead and get started here. So hello again, everyone. My name is Shira Sadoff. Most of you probably knows me as Miss Sadoff. I'm the one who sends you all of our awesome emails and communications for the Human Health Department. And welcome to our Human Health Alumni Panel. Thank you all for joining us. So tonight is going to be a great opportunity to draw from some of our Human Health alumni. They are awesome resources, and we really just wanted to provide you all a really casual environment to ask questions and pick their brains and to hear what they've done and what they're doing and their journeys. So please feel free at the end. We're going to open it up the last 15 minutes for question and answer. Please feel free to chime in and ask anything that hasn't been asked already. We definitely want this to be, like I said, casual, free-flowing conversation, and for you all to get the most out of this time. So for the most of the time, we have some questions that we've come up with. Our Human Health Student Advisory Board, they're like our student leader group, if you do not know who they are. It's about 10 students who are a part of our Human Health program, and they are kind of the voice of our students. So they come back and give us feedback on our classes, our programs, events. They help us plan these things, and they're really awesome in helping us move forward in our program. So 2 of our students from that group are going to be asking the questions that we've come up with in advance. And for anything that hasn't been asked or that you all still are curious about, those will be available to ask at the end of our session. So we are going to go until 8:30. We're going to officially end it at 8:30. But if anybody wants to stay on, if the alumni are available to continue on, that's totally fine. But please don't feel obligated to stay on after 8:30. So I am also going to keep an eye out on the chat. So if anybody has questions during the chat that they don't want to forget or anything like that, feel free to post them in there, and then I will bring them up at the end as well. And then I am also going to post our alumni bios, just a quick paragraph of what they're doing and how they got to where they are. I think those were sent out to you all today if you've registered, but just in case, if you want to skim those over, I'm going to put those in the chat in just a minute here. So we'll go ahead and get started. So I'm going to have our 3 panelists, our 3 alumni, just briefly introduce themselves, the year they graduated, and what they're currently doing. And then we'll jump right into our questions. All right, we'll start with Nivedita.
Hi everyone, my name is Nivedita. It's really great to be here. So I graduated in 2019, so I'm just like barely 2 years out of Emory. I did both a double degree in human health and econ, and I'm currently a second-year med student at Feinberg at Northwestern up in Chicago. So it's nice to meet you all. I hope I can help answer some of your questions today.
I can go next. I'm Mackenzie Brosnahan. I graduated in December of 2015. I am currently working as a healthcare consultant for Huron Consulting Group, and I had majored in human health and global health minor.
So, hi all. My name is Deborah Chen. I graduated in 2017, graduated with a double degree in anthropology and human biology and human health. Spent 2 years in Appalachia, Kentucky, working in health promotion and education, and then came back to Emory, and I'm a second year over at Rollins in the Behavioral, Social, and Health Sciences department. Yes, I think that's right. It's species. We added an S, and now everyone's confused, and it's been a year, and we still don't really know what our new name is, but it's species. So nice to meet y'all.
Awesome. Thank you guys so much. I just posted their bios if anybody wants to skim through those a little bit more, but we're going to jump into our questions. So Egan, you can go ahead and start us off.
Alrighty. Well, excuse me. The first question is, how did you guys all decide what you wanted to do? And I guess we can go in whatever order or the order we did before with Nivedita starting out.
I can start. So I guess I came into Emory unsure of what I wanted to do after I graduated. I knew I wanted to kind of continue probably doing school and doing some sort of health related something, but I had no idea what that was going to look like. And so while at Emory, I think I did kind of various different things in health. I did kind of the pre-med, like clinical volunteering things. I did more of like health policy and health econ. I worked at CDC for 2 years in my kind of sophomore to senior year, basically for about 2.5 years. And so I kind of just tried a lot of different things. And then I kind of ended up in the boat of I was really interested in medicine and I was really interested in health policy. And so I wanted to kind of find a bridge between the two. So I ended up applying to med school my senior year, kind of with the end goal being that I want to go into health policy and health administration by the end of this. So that's kind of the idea. But yeah, definitely just trying a lot of different things definitely helps because I don't think I knew half of the, consulting and administration and all of these things and public health especially. I had no idea those existed before I really got to Emory and was kind of able to delve into them a lot of the time. So I think that was just a really big part of my experience was to be able to try all of those things.
Yeah, I came to Emory thinking pre-med all the way. I very quickly changed my mind, but still had a pretty big passion for health and healthcare. So what I ended up doing was taking a myriad of classes, both in the business school and with the Department of Human Health, and leaning more towards like the policy side. And so at the time, the department was still fairly new, so there weren't a lot of alumni who had any sort of career paths. And so I ended up going into healthcare consulting because I was able to impact, healthcare, but also kind of scratch that business itch that I currently have. And I guess my end goal is most likely going to be healthcare administration down the line.
Yeah, so kind of like Nivedita and Mackenzie, I did come in knowing that I wanted to do something in health. I knew I did not want to do medicine because I can't do blood and I can't do needles. So that completely took all of that off the table, which is good, meant I didn't have to take orgo. But in undergrad, my focus was much more on maternal health. So I did a thesis in DOHAD with Dr. Lample. I focused a lot on predictive health and took a lot of those classes. But when I started working, I actually pivoted into adolescent health. So a lot of my focus is now on adolescent health, and particularly in education. So it's fascinating that Health 100 and the Peer Health Partner Program actually proved to be one of the most valuable classes that I took at Emory, because I actually took those skills and used them when I was teaching my own kids up in Kentucky. So it was really, I kind of just fell into the fact that I enjoyed teaching and I enjoy health education and promotion. But I do know that I've received the skill set in order to discover that love through human health.
Very interesting. I suppose the next question is, what do your guys' day-to-day tasks look like? What does work look like for you every day?
I can start. Well, I'm still a student, so a lot of studying kind of all the time. We're in class for most of the day. If anyone is interested in medicine at all, feel free to message me or anything afterwards. I'm happy to talk about it more. But at the moment, it's kind of just a lot of Zoom classes, as I'm sure you're all used to, and a mixture of critical things as well. So that's kind of my day-to-day right now.
So I actually want to echo something that Deborah said. She mentioned the peer health partners, and I didn't know this at the time, but consulting is a whole bunch of teaching. You work for a company, you're going into a client where they have a problem. That's why they hire you. and you and your teammates get to help solve the problem. But in order to solve a problem, you end up having to do change management. And so having the experience of teaching through peer health partners and facilitating discussion and conversation was absolutely invaluable. And I ended up, teaching and training hospital management how to do their job and how to do it better and how to train the folks underneath them to be more efficient and effective in a hospital environment. So my day-to-day includes a lot of teaching. I also do a ton of analyses. So for consulting, at least the type of consulting I do, having a good, strong Excel foundation is really important. So I think we'll get to this later in the panel, but anything that you can do to strengthen your analyses is going to be key. And yeah, we're in meetings together, both internally as a team and then externally with the clients. And we're trying to basically change an organization. So that's my day-to-day.
I love going after you, Mackenzie, because I can echo some things that you're saying. But like Nivedita, I am a student over at Rollins full-time, so I do have classes, but I also work at CDC. So I'm in the Department of TB Elimination under their Communications and Health Education branch. So there I spend a lot of time in meetings. You'd be surprised how many meetings you have when you start working. It's crazy. But I do a lot of the comms materials, so I draft and write tweets and Facebook posts that are outward facing. I'm helping to run the TB Champions project for World TB Day, as well as a lot of the social media rollout for that. And just sort of a lot of the background work. I do a surprising amount of graphics work. So, all of those infographics and those Canva projects that they make you do in class, they actually do come in handy, surprisingly. And it's one of the skill sets that I didn't think would be helpful, but it has been. And then I also am a graduate student, graduate assistant research student through RISE. And with that project, I did a lot of teaching adolescents. So that was a lot of lesson plan drafting and then teaching those lessons on the weekend to our students. So.
All very interesting answers. Thank you all for saying stuff about your careers. I guess the next question, you guys have all mentioned your experience in the Health 1234 program, or Health 123 program rather, and the myriad of human health classes that you have taken. And I'm just wondering, how has the human health major given you guys a unique perspective / advantage in your field?
I would say, sorry, I'm going to hop in here. I would say in the consulting world and specifically working with hospitals, I can appreciate where the human health major helped me get experience in the social determinants of health. And so it's not just clinical, it's not just finance and numbers, but I'm able to approach these problems at a healthcare system. And, when we're looking at staffing numbers and we're having issues with folks not hitting productivity, well, we can actually go down to like the worker level and say, okay, well, what's actually going on? What is in their environment that's prohibiting them from meeting productivity? So that's probably the big thing, is having more of a holistic view of health rather than it's just, oh, you are sick and in a hospital. There are so many other implications of health.
I'm going to second that very heavily. I think going into medicine, I think one of the big pushes in recent years is to have students have a better understanding of where health comes from and how health develops and changes over your lifetime. And there's only so much we can actually do in a clinical setting. When you go see a doctor, there is only so much that you can do. And so I think a lot of it is understanding all of the factors that come into play in our environment, in the food that we eat, in our exercise, in our relationships, in the places that we live, our zip code. I'm sure you've heard that several times in human health classes, but it's really understanding how those factors all come into play in order to shape, your health and well-being. And so I think as a doctor, it's really, it can be easy to kind of fall back on, well, this is what's medically wrong with them, and this is clinically how this is working, et cetera, et cetera. But I think having that better understanding of where health comes from and all of the factors that can go into it really give you a better sense of what your patients are probably going through, the challenges that they might be facing, and what you could do as a physician to better, anticipate what is going to go wrong or what might happen, and being able to address those from kind of a structural level. And as we've seen over the past few years with gun violence being a really prime example, physicians have been getting involved in all kinds of social issues, and understanding that they have a really big impact on the way that we live our lives. So I think that has been a really big takeaway from the human health major, is just being able to understand how all of those things play together in determining, what we can do as physicians to better help all of our patients.
Yeah, I would second or third, I suppose, everything Mackenzie and Navidita said. But I'd also add that I think one thing that the human health program did really well was it emphasized the role that culture plays in health and health decisions, because, like Navidita was saying, health doesn't occur in a vacuum, and a lot of choices that people make when it comes to health can be tied much further back than we expect. It's not just a split-second decision, it's a decision that's rooted in experiences and culture and all of these external factors. And I think the human health department and program really does a good job at training people to think that way and to realize that there are so many upstream ways that upstream things that are influencing health, and thinking in that manner, sort of thinking about, social determinants of health, also the social ecological model, is really helpful. And it gives you sort of a step up when you're talking with when you're working and also interviewing, because you bring in that understanding that sometimes people have to be trained to think that way.
Great, thank you. And I guess finally, do you guys, or each of you, think that going to grad school is necessary when pursuing a career in public health? And I mean, two of the three of you are in graduate programs, but I guess, yeah. Do you feel that grad school is absolutely necessary, or are there plenty of opportunities to, I guess, understand the wide-ranging field of human health?
In consulting, I think grad school can be very company dependent. My first consulting company that I worked for, I think they thought graduate degrees were nice, but not necessary. And my current company doesn't weight graduate degrees any higher than someone without a degree. So I know I personally have an interest in gaining additional business knowledge to help complement all of my training in human healthcare and public health. However, that's just my personal desire to kind of round myself out. However, I absolutely don't think a graduate degree is necessary to be in public health. If you transition away from consulting and healthcare consulting and look into working in like healthcare administration, I do see a lot more job postings that have preferred that you have, an MHA or an MBA or an MPH. But again, those are very rarely requirements. They are much more often preferred. So depending on what your history is, what volunteer opportunities you've done, what internships, or even if you describe your, your classwork, with all the experience that you do get in the human health major, I think you can definitely get a public health job without a graduate degree.
Yeah, I would say I would agree with Mackenzie. I know I got my first job out of undergrad without needing my master's, but I did come back to get my master's because what I want to do is program evaluation and program tailoring and creation. I think there's a lot of problems when it comes to health and public health in the way that we have created programs and we roll out programs that doesn't take into consideration culture and influences such and other, things that deal with the socio-ecological model. And in order to get into that field, I do need my master's. So I think for a lot of, excuse me for using the term, entry-level public health jobs or human health jobs, I do not think you'll need a master's degree, but to get a foot up into certain programs such as CDC, everyone I know at CDC has their master's. I could be wrong, but everyone in my department has their master's or a PhD. You do need that. So it's more of a keep in mind. Dr. Freeman actually gave me great advice when I was trying to figure this out in undergrad. She was telling me that look for what you want to do and find listings that, you think that you'd be interested in the future. And if they say they want a master's or a PhD, then, you may want to get that in order to get yourself to the position where you would easily be able to get that job, as opposed to having to compete and apply to so many other positions that are like that, because someone has a master's or someone has a PhD. And if they're weighting a PhD or master's degree higher than just the college undergrad degree, then you may be passed over. So it's just something to keep in mind as you move forward. I don't think you need it immediately, but you may find that you'll have to go back and get it in order to get yourself to the place where you want to be and doing what you want.
I agree. I think the only thing that I would add is a number of my friends who graduated, like either from human health or not, who went into kind of public health or health related fields, are currently, working towards getting their master's or graduate degree covered by their employer, which can be really helpful for a lot of folks. So that's always just something to keep in mind, is even if it's not something that you are trying to do right now, if you think it might be helpful later, it might also be worth it to consider waiting for a few years until you have, funding and earnings enough, and there's a company that may be willing to sponsor you through that.
Oh, if I can also cut in real quickly. Additionally, on that note with the funding, even if you're not funded through a company, your work experience may put you at a greater advantage for scholarships. I know that my company was a 2-year contract, so I phased out, but my work experience that I did allowed me to get a merit scholarship through Emory. So I received half tuition through Rollins because of my work experience. So that's also just something to keep in mind. Great point, Navidita.
Well, that is all the questions from me. I guess pass it over to Kat.
Thanks, Egan. Hello, thank you, alumni, for coming, and thanks everybody else for coming. My first question is, how did you guys make use of Emory resources? Which ones helped you the most?
I would say I used a lot of things. So definitely being pre-med, pre-health advising, I cannot recommend enough. They were really helpful, I think, to understand the process of applying and everything. So anyone who's interested in any kind of grad school really or health career, it's always worth it to talk to them. And then if you're going into healthcare consulting and things, both the business school and the college have, the career centers, especially folks who are, focused on healthcare jobs. So those are always really good resources, I think, as you're looking for next steps. But I think in general, I feel like a lot of the resources I used weren't technically designated resources. It was just a lot of people. So talking to your professors, talking to people in the department, you know, as you're going through like extracurriculars and things, being able to know like who to contact about what questions and getting a better sense of, you know, who are potential, not necessarily even mentors. They don't have to be like a full-time role, but it's just someone who you can, you know, ask questions and get help from as you need throughout the course of your Emory career. I think that can be really helpful. So I would say just really talk to a lot of people, just anyone who you find interesting or want to know more about or have something, you know, in common with them. It's always worth it to try and shoot out an email and just say, can I chat with you about this? And, you know, pick your brain a little bit about this, because I think that can be really invaluable in terms of the knowledge that you get from how they've actually gone through the process themselves.
Yep, the Career Center was absolutely key for me. Another thing that I leaned on, I was a part of the swim team, and so we had a very vast alumni network of swimmers who had done health-related consulting careers, and so I, you know, was able to get emails, phone numbers, really just reach out, and I think you guys would be surprised at how excited people are to hear that they would like to get, you know, advice from you or from them. And you guys are aware of Emory Connect. That's something I just found out about. It's like a LinkedIn for Emory, kind of. So I would say as that continues to grow, go ahead and reach out to alumni, whether it's a virtual coffee or if someone's in your city or town, just reach out and ask. You never know what sort of connections you can make from just reaching out to someone.
I had no idea that Emory Connect was a thing, and I'm still here, so go figure on that one. I'll just echo, you know, faculty and staff. I cannot even start to quantify the number of hours I spent talking with Dr. Freeman and just asking her for advice and picking her brain about what I wanted to do after graduation, my thesis, all of that. I also spent a lot of time talking to Agnes McIntosh, but she's no longer there, so I guess I'd be talking to Miss Adolph instead. Just using the resources that are around you and just knowing people. You'd be surprised at how much health and public health is really just connections and who you know that may know someone else. And you also never know who people know unless you ask them. So I know a lot of times over at Rollins, it's been very interesting looking at, you might mention something to someone and then they'll come back to you weeks later and send you like a job thing or send you or connect you with someone else because they remember that you were interested. So it's not necessarily an Emory resource, and it's very cliche, but I would say your best resources are each other and your classmates and your friends, because, you know, people remember things about people and people always want to see other people succeed and help them. So, yeah.
Thank you guys. That's great. That's wonderful. This one's a very good question, and I've had it pop up a lot. How do you guys explain the human health major to other people, to employers, to grad schools, to people that just don't come from the major? How do you explain this?
I can start. I had to explain this a lot on interviews because obviously this doesn't exist in most places. I think the way I explain it is that it's a kind of build your own major in a lot of ways. It's focused on the idea of understanding health from a lot of different perspectives. You know, things like sociology, anthropology, psychology, nutrition. Those are all like parts of the major, but within that you can kind of focus on what your interests are to kind of develop the major further. So for example, because I also double majored in econ, I did all of like the health econ and labor markets, and you know, I did a thesis in economics focused on like health insurance as well. So I think just being able to give them the context of it's really focused on understanding health from, you know, social determinants and cultural perspectives, but also being able to integrate with like the sciences and the hard sciences and maths. And it's kind of a little bit of everything, honestly. So I think giving that broad overview, and then I would talk about kind of what I did with the major specifically and kind of the focus classes and activities that I did within the major. I think that's how I usually go about explaining it.
Yep, I would echo a lot of what you just said. I think I typically start off by saying it's similar to public health, and then go in to describe examples of classes that I took. And so that gives them a much better understanding of how it's public health and more.
It's been a very long time since I've had to describe the human health major, so I actually pulled up my cover letter from undergrad. So looking at this, what I did explain was, like Nivedita, I was an anthro, human bio, and human health double major, and there's actually a lot of crossover with the two. But I talked about how behavior is shaped by the environment, and in regards to health, health-seeking behaviors are drastically sort of shaped by these health-seeking, by behaviors and beliefs and the environment. And I also know I leaned really heavily on my thesis and research in that regard, as well as just the different classes and the skill sets gained from classes. I think, like Mackenzie was saying, the best way to explain the human health major really is to explain it through the lens of what classes you've taken. So, if you've taken the predictive health class, explain it through that, especially when you're talking about upstream effects and you want to go into health, maybe health modification. Or if you want to do health education, explain it through the lens of health. I guess we've changed the name now. So it's 1, 2, 3, 4, but it was Health 100 and Health 200 when I was there. So whatever the Peer Health Partner Program is, explain it through that lens. Or if you're interested in I don't know, maybe if you're interested in another program, if you're interested in maybe health comms, explain it through the lens of, I know Dr. Welkley's classes always have infographics and sort of those sort of projects. Explain it through that lens. Give them concrete examples. And even though the major may not be something that they're super familiar with, giving them examples that they can latch onto and understand is probably your best way of explaining, what human health is.
That's great. Those are great answers. Even I've had to explain it, and I'm still here. Quick follow-up question for that one is, how do employers and interviews react to you guys explaining human health? Is it positive? Is it confusion?
I think, at least in my experience, I thought it was novel. And especially when I was able to explain the broad range of my experiences. I also ended up doing a study abroad, which is medicine and compassion. And so, again, coming from the career lens of, a lot of my job is teaching and training others. And so the fact that I've had schooling and training in compassion and being able to be compassionate while, going through change management, that was huge. So they definitely appreciated the uniqueness of our department and of our major.
I know that my employer reacted very well to the fact that I had training in education and teaching, especially because that was what the majority of what I was going to be doing in Kentucky was. So having that as a selling point was huge, as well as just general communication skills and an understanding of how to communicate health and these topics to a variety of audiences. Especially, with all the papers that you have to write and sort of explaining it in different lenses, or taking research and translating it into something that's understandable is huge. So that was, my employer reacted very well to that.
I think also generally positive. I think grad schools and public health, medicine, whatever you're trying to look into, I think generally want to see that you have a broad base of experiences. And so being able to say, I have kind of a little taste of all of these perspectives of health, I think can be really helpful. So if you explain it well, I think they're probably going to like it, just because they can see how much you kind of seen a lot of different perspectives that I think are really hard to put together in a lot of ways, because you're not necessarily, you know, if you major in any one of those things, you're not going to get a taste of all of the other ones. So I think generally very positive from what I've gotten, although I guess they also couldn't tell me if they didn't think it was that great either, but generally positive.
Okay, good. That's very encouraging. The next question is, what are some steps you recommend current undergraduate students take to prepare themselves for internships or careers in this field?
Practice your communication, practice a bit of analytics, you know, whether you're doing public health data or hospital data or medical data. Data is a lot of what we do now. So I'd say be familiar with that. If you have an opportunity to volunteer somewhere, great. If you have an opportunity to get an internship, great. What else? Yeah, communication. Be able to work as a team. I think that's always incredibly important. And I think that was a really big selling point for me when talking to potential employers, was being able to lean back on like the collaboration that we've had in our classes in the human health major, where, you know, kind of forced to work in groups, which can be very difficult for some folks, but just that's the reality of a lot of what public health is. And just the workforce now is you have to be able to work well together. And so I think that's something that when you're presented with the opportunity to work in groups, please do.
Yeah, I think with that, just I think sometimes honestly it's really just a lot of like doing the things that you're doing anyway, and just figuring out what you're most interested in. I think a lot of the time it can be hard to find, I'm sure especially now, to find like internships and, you know, opportunities to work with people in the field or figure out what they're doing. And so I think a lot of it is just finding opportunities wherever you can to gain experience and figuring out what, I think after every time it's really useful to figure out what you liked about it and what you didn't like about it, because when you go back and you're trying to figure out, you know, what do I want to do, or how do I actually want to end up applying to an internship or a job in this field, it'll be really useful to know, you know, I really liked the stats part of this. I like the analytics behind this. I think that was really important to me, versus, you know, I want a job where I get a lot of people interaction and I'm able to work with a team on a project, and you know, we're all working towards, you know, this project or something like that. So I think it's really useful to know what parts of it you like and what parts of it you don't, because this major is so flexible and can be used in so many different fields. It can kind of seem daunting at times to figure out how exactly you want to apply it. So I think that was a really helpful thing for me to keep in mind, which I didn't figure out until like my senior year, and I was trying to write apps and I was like, I don't know what I gained from this experience. So I think just trying to do that in advance will be helpful, because you get a better sense of, you know, what you want to end up doing, and how you can actually talk about it is going to be the most important part of like interviews or anything like that when you're applying for things later.
Yeah, I would agree with both of you. In regard to the group projects, I know that's one thing, especially within the public health program, that they keep reiterating, is that everything is group work. Every project you work on will be group work once you start in, you know, the actual fields. Some of that is true, some of that you do by yourself, but a great majority is group work. And if you can't work well in a group, I hate to say it, you need to learn how to work well in a group, because it will make your life a lot easier, or you'll struggle a lot. As well as just, you know, like what Nivedita was saying, just don't roll anything out yet. You you have time to explore what you want to do. And if you see an internship that, you're like, well, maybe I could try it, maybe I couldn't, just apply for it, try it, because you won't ever figure out what you like doing until you've actually done it. And there's no point in, self-selecting yourself out of it. We talk all the time about bias, right? Bias in studies, bias in self-reporting. If you want to avoid that sort of bias, then you should try it just so you can see whether or not you like it. Also, I would say keep track of every project that you do in class. Be it in the capstone project, be it just the small projects you do in class. So that way you have a list and sort of like a portfolio of projects that you've done, so that when you're in an interview and someone asks you for an example of something, you can pull that out and you're like, oh yes, I did this, and give them that concrete example. Because once again, having that concrete example shows that A, you've done the work, B, you know what you're talking about, and C, it allows them to see that you produce good work, and you produce work that they might want someone to be able to produce in their job or in their company. So that would be my advice.
Deborah, I am echoing that 100%. I actually have a folder on my personal computer for my work stuff, and then one on my work computer. I actually call it the gold star folder. So that's where, you have any kudos from coworkers, or as you said, just a list of things that you have done. And it makes it 100 times easier when you're going into any sort of interview to have those solid examples. And you'd be surprised, I'm now assisting my company with some of the hiring and interviewing. And it's very, very clear when you have a candidate who has done their homework, who has really thought about what they have done and how they could contribute to your company. So absolutely put together your examples of what you're currently doing, because you guys are all doing really great stuff.
That is excellent advice. That's wonderful. This one's a little bit more difficult. So many jobs require prior experience before applying. How would you recommend getting experience when it feels impossible to get? And it seems extra hard because of the context of, our situation right now, but yeah.
I honestly hate things that say prior experience, because every time it seems really hard to get experience in things when everyone wants you to have it already. I think the way I sort of got around it a lot of the time was kind of signing on to a lot of different projects at like their very initial stages. So just reaching out to a lot of people, especially for research and things, trying to figure out, building relationships with professors beforehand. So if something comes up, you're kind of like the person that they're like, oh yeah, like you should probably talk to this person about this or something like that. So I think kind of reaching out to people in advance who you think would be helpful is definitely one part of it, and kind of maintaining those relationships and being able to, explain why you're interested in it, so that they can go back, and if they hear about anything, they're like, oh, I thought of this that might fit your interest like 2 weeks later. I think that happens more often than you think. And along with that, I think also don't be afraid to apply for things just because it seems like they're looking for someone who has a lot of experience. I applied for a job at the CDC that, there were like grad students and like professionals applying for, and I was like, there is no way that this is going to work out, and it ended up working out in the end. So I think a lot of it is just about, understanding what their needs are, making sure that you kind of either have the background and the skills to be able to fit that role, or figure out a way that you're going to be able to learn those skills in that role, and being able to explain that really well when you're applying for internships or jobs or whatever it might be. Because a lot of the time, especially I'm sure now, people are willing to kind of give you a little bit of leeway and a little bit of flexibility on those requirements and kind of what those prior experiences might look like, just knowing that you're not going to be able to build those same kind of things when you're not in person and you're not, meeting people. I think that'll be beneficial to you just to get a lay of the land and talk to as many people beforehand as possible. And a lot more opportunities come out that way that you might get by, you know, applying to everything that you see on Handshake or wherever you're looking for research opportunities or jobs.
Yeah, I would echo, definitely don't be afraid to apply for something if you don't fit perfectly into the box. As well as, I know you guys are all still in school, but if you are looking at an opportunity and there's a portion of whatever the job description or program description is that you're not quite fitting, there are a whole bunch of other resources, even like online, to look for a online certification or course, or even just read up on it. And you can go into an interview for a program or a job with whatever knowledge that you acquired on your own too. So you may not have direct experience, but you have the book knowledge in a way, and that can still be beneficial and useful if you're able to articulate what you learned and why it would be helpful for them, or why that helps you fit into whatever program you're applying to.
I was about to ask how you're operationalizing experience, which Mackenzie, I think you're hitting on with that. Because technically experience could really be anything. When they're asking for experience, you know, if they're asking for experience in communications, you could argue that any sort of infographic or any sort of graphic project you may have had to do for class is technically a communications project and a communications, you know, piece of work. So I think when it comes to that, you know, reaching out to people is great, but also knowing that the human health program does provide you with a lot of experiences just within the classes and within the way that the projects are designed, that you can tap into, and you can say that, you know, I may not have on the ground experience or workforce experience in this, but I do have experience in doing this, and this is what I've done. And because of the situation, I think a lot of employers would understand that, because if you don't have an opportunity to do it live, and what you can say is that, you know, this is what I've done in the past, this is what I did in class, and I look forward to having the opportunity to do this on the ground or in the workforce. And a lot of people will accept that and just, I hate to say be happy, but they would appreciate the fact that you are acknowledging that, but you also acknowledge what skill set you have, and you understand how you can use that in whatever they want to do or whatever they want you to do. So
I really like the phrase, you know, you have exposure in something. You may not have direct experience, but one way to draw upon what you're learning in your classes is saying, okay, now I've been exposed to this topic. And that can really help get your foot in the door.
yeah, especially because some people might not have any exposure at all. So the fact that you even have just a slight understanding of something does, like you said, give you a foot in the door, as well as maybe a little bit of leverage.
Okay, thank you guys so much. I don't want to steal all of the attention, so if anybody has any questions, is there any chance? If anybody has any questions, please feel free to unmute or to type it in the chat. You can get direct interaction for the next 10 minutes. So.
I wanted to ask you, as people who are in grad school now and kind of working at the same time, do double majors, like for example, Neve, that you said the human health and econ double major, like does that make a difference compared to maybe doing an econ major with a global health minor?
I would say from my end, I think if anything, it just kind of prepared me for the workload, because you end up doing a lot of different things related to a lot of different topics, which is kind of what you end up doing in grad school in a lot of ways. Even though it's focused on one topic, you're going to be addressing it from a lot of different angles. So I think time-wise and kind of understanding responsibilities, I think it was helpful, but I think you would also get the same experience if you were doing, let's say, like a major and a minor, or just a major like human health, where you're probably end up doing a lot of different things. I think for me personally, the reason that econ and human health kind of fell in place was partially that I was really interested in both, and I found really great advisors in both departments, but also a lot because they have significant overlap in the ways that I wanted to approach health as a student. And so to be able to understand health policy and things like health insurance and coverage and access to care, I really needed to be able to understand both the business side and the kind of more sociocultural and social determinants of health side. So I think I don't think there's any world in which you need to do two majors or a major and a minor in order to achieve something in any way. But if those are two things that you're particularly interested in, you want to develop those interests further and figure out how they interact with each other, I think it can be a really great way to do that.
Thank you.
Would you guys be able to send your LinkedIn or email possibly so we could message you afterwards with other questions?
Absolutely.
Thank you.
Yeah, I can link my LinkedIn, but since my email is technically an Emory email, honestly, you just can type in my name and it'll pop up. But I'll drop the link in LinkedIn in the chat.
I'm going to add my personal email in the chat here.
Any other general questions or specific questions for our panelists today?
No? Okay. Just wanted to give everybody the chance to. If it does pop up within the next 5 minutes, 6 minutes, please put it in the chat. But the last question for you guys is, where are you currently located geographically, and why did you choose that area? Is your field specifically catered to issues in that area? Deborah, I'm very interested in why in the world you are in Kentucky. So feel free to answer that one.
I saw the question and I went, oh, I can answer that one. This will be fun. But okay, I guess since I'm already unmuted, I can go first if y'all don't mind. Technically, I just saw the position without looking at where it was located. So I worked for 2 years in Appalachia, Kentucky, in southeastern Kentucky, in a little town called Barberville, which has about 3,500 people. It's Knox County, Kentucky. So the position there was something that I was very interested in. It was health education and health promotion in adolescents. And I didn't really look at the location, and I just sort of applied and got the position. But I chose, so it wasn't necessarily that I chose to work there, it was sort of that it kind of fell in my lap. But the field and the research that I do now, so my thesis for my master's is looking at how schools in rural Appalachia responded to the COVID-19 pandemic, specifically looking at their response to food insecure students reliant on the free and reduced lunch program. So a lot of my work and a lot of my understanding about how policy might not be as tailored as it could be, and how beliefs and culture really influence health did come from my work in Kentucky, because culture there is very different, and the way that programs work there is very different than what we might assume is in Atlanta or any urban area. So that rural perspective is something that I've taken with me, and I know influences a lot of my work. Which is why I would say if you're looking for a position, just apply anywhere, because you may not expect it to turn out to be all that great. But I loved my time in Kentucky, and it was probably one of the most fun adventures I had, because it wasn't what I expected. And as long as you go in with an open mind, you will be very surprised by wherever you work or whatever you end up doing. So yeah, that's how I ended up in Kentucky, but it's a fun story. Dr. Freeman heard most of this.
So I am currently out in Seattle, but by way of Chicago first. So right after graduating in December of 15, I started working in Chicago and made the move in the dead of winter in January of 16. So I decided to go to Chicago because it was a larger city, and that's where a lot of consulting firms are either headquartered or have offices. And it's also close to where my family's from in Minnesota. And I am now out here in Seattle by choice because I love the mountains. I'm an avid outdoors person, hiker, climber, skier. And in consulting, it's very nice. Well, pandemic aside, we are able to essentially work from anywhere because our clients are everywhere. And so we at my company currently have 25 major cities where we can live, and your client could be, you could be staffed anywhere. My first supervisor lived in Atlanta and our client was in California. I live in Seattle, and both of my previous clients were in California. So that's where I'd like to live. And there are a lot of healthcare systems all over the country. So in a way, as far as working in a healthcare system, you can basically live anywhere and find a healthcare related job.
So I am currently in med school in Chicago, but I am actually from Seattle, so I'm the opposite of Mackenzie. But Chicago, I think I really picked in a lot of ways for Chicago itself. For those of you who don't know, Chicago is a really cool city, but it's very divided in a lot of ways, both in terms of the demographics, in terms of access to care, access to resources in general. Chicago has a lot of interesting history. So I think a big part of that for me was I wanted to sort of be in a pretty urban setting. I live downtown, like smack in the middle of downtown. And it's been really great because I get, access to a huge variety of patients who all come through Northwestern because it's a huge hospital here. But also I work in a clinic every week that is out in sort of the more suburby, honestly, in a way is a lot more rural area of Illinois. So I get to see kind of a balance of the two, which I really appreciated. So I think going into medicine, I wanted to be able to see different ways of practicing medicine in a big hospital, a small hospital, a clinic, whatever it might be. So that was definitely a big part of my decision to come here.
Thank you guys so much for your time and your effort, and just for being here and talking to us and answering all of our questions. It's been very helpful, and I definitely get a lot of these questions from students, and so I'm sure we all got some good takeaways, and just from your all's background and your journeys and your unique experiences. So we really appreciate you all. For anybody that has any other specific questions or wants to further connect, go ahead and see the chat for Mackenzie, Deborah, and Nivedita's information. I'm sure they'd be happy to connect with you outside of our Zoom call. So thanks again, everybody, and I hope you all have a wonderful night.
Everyone.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.